Hey, it's Dr. Angie Settle with Your Health Done Right from West Virginia Health Right. Today, got one of my favorite people in the world. It's my clinical manager, Rhonda Francis, who's been with me forever and a day. We have something exciting to talk about, a big change. A lot of you guys know over the years we have worked with a great group, Remote Area Medical. Since the historic flooding happened in West Virginia in 2016, we paired up with them. They come every fall. We get together with our volunteers. We do this great 2-day mass free clinic with free medical and free dental and vision and you name it. And this year we've agreed with RAM. We have expanded our space on Washington Street East. We have the facilities now. It's 30,000 square feet. We're having a grand opening pretty soon. But we're saying all this to say that we're going to do our own event. It's going to be We Care West Virginia Day. We're going to start with the one-day event, and then we'll go from there. But it'll be October the 19th. All the same things apply with the free dental and the free medical, free vision. We'll get to do some expanded stuff, which Ron and I are going to talk about. But we'll be doing it at our facility at 1520 Washington Street East. So we wanted to kind of get the word out on the event, explain why we're changing, and you know, like I said, we love Remote Area Medical, but it'll be our event. We can control the times, the start times, etc. So I brought Rhonda on because she has been with me on this event since the very beginning. So welcome, Miss Rhonda Francis.
Thank you.
How are you today?
I'm excited to be here and excited to talk about us taking this on.
So anytime we do any big change, we get these big ideas. Most of the time, Rhonda has to help me carry them out. So Rhonda is logistically great. She does the things as far as helping me line out things. We have 84 Company, which is helping do all the design to get our volunteers signed up and patients. We've got new logos. We'll have great T-shirts. We wanted to pick a theme. You know, we batted around for a few months to, you know, what we wanted to call it, and we came up with We Care West Virginia Day, which I think they'll have the logos and everything. Basically, that just captures what Health Right's about, what we do every day there. But this event's a little different, of course, because for this one day, it's a no questions asked clinic. Anybody in need can come. We're not asking proof of income. We're not asking about insurance. We're not asking any of those questions. It'll be just come, show up, and you're going to get care. And all the volunteers that we have that day will be there for one reason, and that's to take care of people in need. So let's talk a little bit about it, what we've done at RAM, what we'll be doing with this, and how that's different. You go ahead, Rhonda.
So we're excited about this because it is a one-day event, and it will be 8 to 5. We are going to do the same services that we've done before. So they'll do a check-in and then be triaged. So they can decide if they want medical, dental, or vision. And I'm sure there'll be time, we can talk about this later, but I'm sure there'll be time that they'll actually want to have two things done that day.
Yeah.
And of course, we'll have our mobile unit out there as well. But it's, well, actually, this makes it nicer, too, because we have the pharmacy on site as well.
Absolutely. Because before, we would have to take samples and and then every once in a while, we'd have a physician see somebody and ask, do you have that? And we wouldn't have it there. So now we'll have it. We'll have it on
so
site.
This makes it a lot nicer as we'll have that. And, of course, you know, it'll be in the fall, so we'll have vaccines available for flu and COVID. We'll be able to do that, and HIV and Hep C testing, Narcan training.
Absolutely
We've
great.
got all of those things available.
So,
Women's health, there's just a lot that we do.
With the expansion, which, you know, we've expanded our space, doubled the space. We'll now have the space needed to do this event. You know, we worked with great partners at the Bible Center School, which we love them, and this is, you know, we've been happy, but it just makes it better if we can keep it in-house. We have all our supplies. We have, like you said, everything in the pharmacy, our computer systems. The big change is the time. Because as much as we love the event, we love it, there's certain rules and regulations that Remote Area Medical Center follows because they do these like all over the world, all over the country. So they give the tickets out. They open the parking lot at midnight. They give tickets out at like 3 a.m. that's how it's done. And then the doors open at 6 a.m., which we get it because they're trying, to plan and get people through. But that can be a deterrent. That can be a deterrent for some people who don't maybe have a car or they don't want to be out in the middle of the night. And a lot of times it gives the impression, that the lines are super long and then people are afraid to come if they can't get there that early. So we wanted to do something where, it would start at 8 a.m. So it's a more reasonable time, and we're going to go till 5 p.m. And, where we've strategized and done stuff like this before, we know how to fit people in the schedule and maximize our volunteer time. So the volunteers themselves will come at 9. The patients will be there at 8, and that's smart because we know it takes time to triage, et cetera, and you don't want to have volunteer dentists like Dr. Garib, one of our favorites, who's a go-getter, standing there with nothing to do while they triage patients. So this will be good. They'll be ready to go when we get those volunteers there. So that's probably the biggest change. Of course, the name's different. We Care West Virginia. We have our own website and links and all of that where our volunteers will sign up. But a lot of the concept will be the same, of course. But we love the fact that the medications will be there. We'll have more ability to do different things.
Absolutely. I think it's easier to do on site now because, as you said, everything is there. We have a lot more exam rooms. So with the new expansion, we've got 11 exam rooms on the primary care side. So, even with specialty there, ortho and things that come there, they'll have their own space. And instead of us having to take everything up there, before we always had to box everything up and travel up the day before and set everything up and then at the end tear it all down. This way, it's right there. Everything's in every room. And anything that we need overstock-wise, we have on right there on site, and we can just go get it instead of running back and forth.
Absolutely. We even would have to do like porta potties and security guards and all of that, which I understand, but that's, extra expense and time. And then we have our 6-chair on-site dental clinic, plus we have the mobile clinic that'll be there with 3 chairs, so that gives us 9 chairs. We'll have 2 Panorex. Everything will link to our electronic medical records, so we don't have to, because that's always a thing with, the technology of today's time. Everything works, with the internet. So if things aren't connected and you can't take x-rays, it's a pain. So that part will be great as well. We have our, staff kitchen that we can use to feed volunteers and get organized. And it'll more than likely grow to a 2-day event. But since we're doing our own thing this year, we want to go with the 1 day, make sure that we can maximize, learn the schedule. We have the same great volunteers, Dr. Tom Takubo, Senator Dr. Tom Takubo, who will head up our medical division. We have Dr. Chris Stansberry, who will head up our vision department, and then Dr. Tupta, Michael Tupta, he's on our board, but he's one of our volunteer dentists, and he will head up the dental region. So we're still doing all of that, the same players, and everything else will be the same. It's just a name change, location change. And I'm sure we'll have some growing pains logistically to go through, but we have a big lot there, and everything will happen there at 1520 Washington Street East on October the 19th. Some of the other changes, I think, we'll be able to do more care, more services.
We will. One of the things, though, is that we will not have the eye on site to make them on site, but we will be able to send them off and get them returned to the patient.
Yeah, Remote Area Medical Center has an on-site eye making bus machine, so people can get them the same day and leave with them. We don't have that capacity yet, knock on wood, if we ever would get it. But this way, we work with the vendor. We'll be able to have the glasses, get the person's address, and then they'll be mailed in a short time. So we're going to work with them to do that, and that should work. That's one little hiccup that we're going to work through. But we have the space there at the clinic, some unfinished space. We'll be able to have multiple eye exam areas there that we've talked to Dr. Stansbury about that we're going to work through, and we're really excited about that. Again, the name reflects, We Care West Virginia. It's West Virginians taking care of West Virginians, and that's something, the premise of the whole event. And if you happen to be, a medical provider, a physician, a nurse practitioner, a PA, a dentist, an ophthalmologist, an optometrist, we would love to have you volunteer. I don't know what the site is offhand about what they do to sign up to volunteer, but you can definitely email me or call me. I want to go ahead and tell you what those numbers are. You can call me directly at my office at 304-414-5931. That goes directly to my desk. Or Settle, SETTLE, at WVHealthright, RIGHT.org. And they may have them posted because we've done all this stuff to put these new sites out. And forgive me, I'm the CEO and there's so much stuff going on, but I can't remember all the links. But we are developing those so that there'll be direct sites to volunteer. Of course, HealthRight's always seeking regular volunteers for the day-to-day stuff as well, so we'd love to have those volunteers. But we need to start now to make sure we have enough dentists, enough eye doctors, enough hygienists, enough RNs, and people that you know, feel strongly about the fact that access to care in West Virginia is so important. We know, you and I know this, we do this day in and day out, Rhonda. Even if people have insurance, there's high deductibles, there's reasons that they can't get care. We have remote areas of the state that maybe even people have insurance, but they don't have access to that provider. At this event, we usually have an orthopedist. We know Dr. Takubo's a pulmonologist. You know, you have access to a lung specialist, a lot of things that you normally may not have. We do women's health care that day with female exams, breast exams, pap smears, like you said, vaccinations. We do HIV testing, hepatitis C testing, Narcan training, all of these things offered that day, and it's all kind of a one-stop shop thing. We haven't talked about it, which we probably shouldn't until you said that, about if it's going to be a one-service type day or if they're going to be allowed to do multiple services. What generally remote area medical does is they do one service and then they get reassessed, which is probably what we'll do is say you pick your number one, the number one thing that you need today. But we'll make sure to try to keep all the areas busy so that people, and, you know, if we see, you know, it's 1 o'clock or whatever and there's an area slowing down, we can always then take additional patients. We want to make sure, which we always do, maximize our volunteers and our time and get as many people through for care as possible.
Absolutely.
Yeah, absolutely. So we get a lot of board members that come out and volunteer. You think about Jack, our pharmacist. We get Franny. Love Franny. Franny is one of our longtime volunteers. She's been on our show. And she went and did additional training, became a farm tech so that she could legally volunteer in our pharmacy. And she comes out and helps. She always helps on that event. So it's always a good way to connect with the community. It's a lot of, you know, you and I can tell people all day long what we do, but it's a great day to come out and actually see HealthRight in action.
Absolutely. And we get a lot of students that come in that actually need in their clinical hours. And even high school students that'll need for volunteer hours that we'll use. But there's a lot of students, as you said, for the vaccinations. You know, University of Charleston School of Pharmacy is a big help during that time. They're usually the ones that'll set up and do the vaccinations for us.
Yeah. Well, and that reminds me, we're actually launching a new initiative at HealthRight for volunteers. We've always had the volunteers with, you know, our medical volunteers and especially volunteers. We're trying to do something new because our facility has grown in size and scope that, you know, sometimes with a new facility, we even need, you know, people to guide patients from one section to the other or be kind of informational. So that's something that's launching. I don't know if it's launched or it's getting ready to launch a program for volunteers where we would welcome like high school students, college students, those people in the summer. A lot of times there's different schools that require volunteer hours or kids that are just interested in the medical field. In general, we get a lot of that. You know, my child is interested in XYZ and can they volunteer at HealthRight? This is a great program. That they can do that, where we'll have them, we'll utilize them to their capacity. We're not going to have them extracting teeth or anything like that, but we'll have them helping get that one-on-one with our patients and guiding them and do things that we need in the clinic. It's so hard, you know that as a nonprofit with a tight budget, to have enough staff to do everything that we need. So I think it's great that we can utilize those volunteers. Again, there's a website for that, but you can call me, 304-414-5931, or email me, asettle, S-E-T-T-L-E, at WVHealthright.org if you have a child or you yourself would like to be involved with West Virginia HealthRight. Something we've talked about, and it's just a staple of the clinic about being a volunteer. You know, giving back warms your heart. It does. I mean, it's great to have a paycheck and get something in the community and do your thing. But this gives you an opportunity, even if it's 4 hours a month, to just come in, and give back. It actually meets some of the people that we treat every day and see some of their struggles. While we're at it, Rhonda, without using names, I know you get to see a lot of this firsthand. Tell us a few stories so people get why we do what we do, of some of the patient situations that's coming in right now and what you're seeing, the need.
So what we're seeing right now is, of course, we've increased, like we've talked about. For instance, last month we have 177 new patients that have came into West Virginia Health Right. A lot of these patients are working 2 and 3 jobs. It's not that they're not working. They're holding down 2 and 3 jobs. But, with the increase, of course, as everyone knows, food's increased tremendously since the pandemic. They can't afford it. And so, and they're not making enough to take out insurance. And then they make too much for Medicaid, because you have to be 138% of Medicaid. So they're coming in, and we're seeing struggles. It's not just that, needing medications and things and needing someone to see them. But then we start finding out, they're going to lose their apartment or their house. We have great social workers on staff that are, automatically working with them, or they can't pay a power bill. And it's just increased in the last few years, worse than what it was a few years ago.
Absolutely.
We're seeing it more and more and more. It's heartbreaking. And
it is heartbreaking.
It's not just the younger generation. We have patients that come in, older patients, 65 and older, that are the same thing. They have their Social Security, and they can't afford toward the end of the month to even buy food or pay their bills. And so, they're coming in as well. We're doing a lot more case management than we ever have had to do.
Absolutely.
Than before.
So what, and I know exactly what you're talking about. We have a lot of patients, that get Medicaid, and that means you can make up to 138% of federal poverty level. If you want to know what federal poverty level is, you can Google it for how many people are in the household. What is it for one person? What is one person, I know allowed to make a year to qualify for Medicaid?
Well,
So
like
18,000.
Yeah, it's extreme.
Around $18,000. So that means if you make, say you're working hard at a job, and they give you a raise, and suddenly you're making $19,000 a year, then you wouldn't qualify for Medicaid anymore, which means suddenly you have no health insurance. So you're taking 2 steps forward, 3 steps back, because then they're faced with the fact, okay, do I get insurance on the marketplace or whatever? Even if they can get those insurances, a lot of times they have high deductibles and co-pays, or certain drugs that aren't covered. We have a huge population that has diabetes, high blood pressure, heart disease. A lot of these insulins, that's probably the #1 item that we spend our budget on at Health Right, is buying insulin for people in need. So you think, it's great. We want people in West Virginia to work. We want people to make the best of themselves. That's great. You got a raise. But then you have a situation where people are faced with, A, do I work and lose my insurance? Or do I, B, try to make less, quit my job, cut my hours so that I can still get health care? And that's not anything that we ever want people to be faced with. And that's the important factor of our clinic, other free and charitable clinics, is to stand in that gap so that we can give them that lift that says, yes, better yourself. Yes, get that job. Get that raise. Isn't that great? And here, you don't have to choose between life and death. You don't have to choose between a job or working and your insulin, which is so, so important. It's nothing. I know you do this every day, because you're the one that orders the medications, and I'm the one that approves the bills where we pay for them. But it's nothing for a patient to get $3,800, $4,200 worth of free medications from us every month. Some of those we're able to get through drug programs where we have to show proof of income and really show that the patient qualifies. A lot of those we're buying. We're paying retail for patients. And that's why we're out all the time fundraising and telling our story, to try to let people know how important it is, because it's literally, it's life-saving work. It's life-saving work. If you have a patient you send them out without insulin, how long is it going to take for that situation to go south? When we have people that are trying to ration their insulin and take less and make it stretch, and that's a horrific situation. A lot of people don't know that unless they're doing this day in and day out, but that's something that we deal with. So we do see people with Medicaid because there's so many services that are not covered. You think about it. Certain dental issues, vision issues, et cetera. That coordination of care that you're talking about, or maybe somebody's got a behavioral health issue, they're really struggling. You know, we've grown with our behavioral health program. There's people taking injectable antipsychotics, very complex issues. I know I'm getting off on a tangent, but when you think about somebody trying to get up every day and work, and they're struggling with their mental health, people that don't have access to care, lots of places people can't access mental health care or get their medications, and that's a service that we offer as well. If people are struggling to find a place, if you don't have insurance, you have Medicaid or Medicare and you can't get in for behavioral health care, call us. Again, you can call our clinic. It's 304-414-5930, and we'll get you in. We're doing as much as we can capacity-wise. You know that, Rhonda.
Yeah.
So much need. So much
It's a
need that
huge
you're
need.
seeing.
And when you're talking about the behavioral health, during the pandemic, we gained 10,000 patients just behavioral health. A lot of patients now have anxiety, depression that didn't have it before. We're like the #1 state for depression.
Yeah, that's true. We just had that recently. We were
just
talking about
had
that.
that.
The
The data
study
came
came out
out,
that West
so,
Virginia is #1 for anxiety and depression
yeah.
in the nation. Yeah.
So there's a huge need there. And of course, you know, with us as a patient-centered medical home, we're able to do all of those wraparound services right there, so that, as you said, things that are not billable, we're going to do them anyway, because you want to make sure they're taken care of. So they may see dental and the provider and behavioral health on the same day.
Right.
That way they don't have to miss work. We schedule it that way so that they're not running back and forth. Or even our recovery patients need a telehealth for their recovery session.
Right.
So they do that at lunchtime so they don't have to miss work.
Yeah, because we found, again, you can't compartmentalize those services. There's so many people that struggle with substance use disorder that have a behavioral health disorder. Very, very common that those overlap. And it is near impossible to treat and eradicate a substance use disorder problem if you don't treat properly the behavioral health problem. It's very complex. A lot of people don't get it unless they're doing this work day in and day out. You can't just say, well, I'm going to just treat you for your issue with opioid use disorder, but we're not going to treat the fact that you're bipolar. And people don't understand that. And if you want to see something terrible, we talk about insulin. We talk about people can't abruptly stop insulin. But if you want to see something truly sad, is a person that's pushed out of a mental health hospital, behavioral health hospital, or somebody with like 3 days of medication, and they're sent out without anything else. And to have somebody have to abruptly stop medications for behavioral health, whether it's an antidepressant or antipsychotic treatment for bipolar, that truly is horrific. And people can drastically become very ill very fast, become suicidal. We've seen it day in and day out. And it's so hard because there's no hard and fast black and white rules at all on that. What we try to do is, as people come in, we just take the situation case by case by case by case. And I think that a lot of people, when we talk about case management that we do, they don't understand each situation for every patient is so different. Their history, whether they came from another state and they're here with 2 days worth of medications, whether we can access their records to actually see for sure what medications they were on. It takes so much time to track down records and hear these things when people are transient or they were discharged, and all the HIPAA regulations that you got to go through and get things authorized and signed. And meanwhile, you have somebody that's struggling. A lot of the patients that are in our local shelters, we treat those as well. A lot of those people will come through, get off a bus and they don't have any medications, and they're in crisis, and we're trying to set them up for their best success, and they can't do that without medications, for sure. So anyway, I know this is a soapbox that you and I are both on, but that's something that's growing complexity-wise.
It is growing complexity-wise. We are getting more and more complex patients coming in.
Yeah, and that takes more staff.
It does
We
take
now
more
have
staff.
8 full-time nurse practitioners. We have all our volunteer dentists, volunteer doctors, etc. We don't pay physicians or dentists to be on staff. That's how we do what we do. They're all volunteer. We have an army of 500 volunteers that come in, but you have to have that base of somebody to be their primary care provider, lead their team, so that even when the volunteers are there, if there's an x-ray or lab that come in, that they're coming back to that team to manage that patient. And the volunteers come in, some of them will come in, six hours a month. But, that might be on a Thursday evening, and then Monday morning they get in a crisis. We got to have somebody there to take care of them. So that's important, but I think that's something that a lot of people don't understand is so different about our clinic, free and charitable clinics. It's not money focused. It's not reimbursement focused. We don't worry about whether the time spent with the social worker is going to be something you can bill for. There's a lot of those things you can't bill for, even with people with Medicaid or like uninsured. There's not a pay source anyway, but such important time is spent keeping those people on track, keeping those people housed, keeping those people healthy, behavioral health-wise, so that they feel like they have a place to turn. We are often the last resort.
Yeah.
The last resort that people call us up. It's a case by case by case by case basis. I'm not going to go into any detail, but now that we have that partnership on the west side with the food pantry, I had somebody reach out to me. She's employed, her husband's employed. They got in a situation, and they have children, where they didn't have money. It's a long story. They had an unexpected expense, and they reached out to me and said they were worried that their kids were going to go hungry, and that they were praying for a fix, and they were trying to get this thing taken care of. But did I know anybody that could help them? These are two people, both employed, struggling, working every day, seriously concerned about a short-term fix for their kids. And of course, what we did, we connected Shayla, we got with Pastor Haley, and our staff met them and created a food box for them on the spot to make sure that they had food to feed their kids. That's not anything anybody ever wants to do, is to try to get in a situation where they don't have anywhere to turn. And that's probably a one-time thing, and then we send her on her way, and we probably won't be having to do things like that again, but there's so many factors. So many factors that impact their health that we deal with day in and day out, and it's really hard. So many patients that we see. We now have 44,000 patients, and it's growing. And, it strains our budget, of course, and people say you got to learn to say no, but I just say, who wants to come and tell that lady you can't have your insulin? Or tell the lady that called me, I'm sorry. We do what we can, as much as we can, on the budget that we have, and God willing, knock on wood, we can keep doing it. I never want to be in a situation where we have to turn people away based on money. We keep doing what we can do every day, every day, every day. It's something that weighs heavy on your heart, and it weighs heavy on my heart.
It does, which is, for years I did a for-profit, which is why I got out of it, because I used to go home and cry because they wouldn't give patients their medicine because they didn't have their copay. And of course, then I went to a nonprofit, but I've always been a stickler about that, to making sure that patients getting taken care of regardless of what they can pay or not.
Absolutely.
And of course, we don't charge anything.
Absolutely.
So there's no charge.
All services at HealthRight are free to patients. We don't charge copays or sliding scales or any of that. It's something we're committed to. We got about 15 seconds left. We got to cut off on a tangent. If you're in a situation you need help, call our clinic. It's 304-414-5930. As long as we can do it, we'll be there. We'll keep helping people. Thank you, Rhonda.
Thank you.
And look for We Care West Virginia Day in October.
Yep.